Dr. Daniel Hoover here with SOHMA Integrative Medicine. I want to talk to you about spinal decompression and how to avoid back surgery. I want to start off with a question. Do you want to have back surgery? Do you know anyone who wants to have back surgery? Of course not. It's so rare. Now, there's a few cases where I just want to get it over with and hopefully the surgery works. But for the most part, we don't want to have such an invasive procedure that we can risk death, infection, the pain could be worse, and the surgery doesn't even work at all. Now, that's not to say that surgery is a bad thing. There's a lot of serious inherent risks. And one of the risks that we see a lot come into the office is that when there's a failed back surgery, they did not remove the generator of pain. Most of the time, the generator of pain is a disc bulge or a disc protrusion pushing out on a nerve, causing debilitating pain where someone just stops from the shock. They can't walk, they can't talk because it's just too intense, or numbness and tingling going down the foot. Fortunately, the root cause is mechanical. It's literally a piece of material, a disc bulge pushing on a nerve. So what do? Well, we can cut that disc bulge or we can pull it back in on itself. Now I want you to use your imagination here for a moment. My hands are the vertebrae, and between my hands, the disc. So it's this bouncy little disc right here. Imagine that it's like a jelly donut. If you squish a jelly donut, the gel goes out the back. And guess what's over there? The nerves. So we can snip that off. Or what if we could just decompress that disc? It's going to draw that disc material back in using a negative pressure. And that's what spinal decompression is all about. It's very simple, it's very specific, and we're helping people avoid back surgery all the time. There's some happy side effects with non-surgical spinal decompression. Number one is we get you out of pain, get you into balance and back to play, doing the things you love. Another thing that we kind of found out by accident, you're going to be a little taller because remember, when that disc is compressed, it's shorter. As we decompress, we're drawing more fluid back into that disc through a process called imbibition. There's going to be a test on that later, and you're literally going to be a little taller, if that's okay with you. So just know there are options. There's non-invasive, conservative treatments that can be done before surgery. And again, we're not against surgery. There's a time and a place. And if and when a patient needs to have surgery, here's what I tell them, and here's what I'm going to tell you. This is the best time in the history of humanity to have surgery. But is that your first choice? Is that what you want? So consider non-surgical spinal decompression the next time you have sciatica, low back pain, or neck pain, radiating pain down to your fingertips, your toes, and hit the subscribe button here to learn more about other safe ways to get better.